Hello, I'm Dr. Kathleen Benton, the President and CEO of Hospice Savannah. What's going on our world today? Lots of evolving, lots of changing, lots of mergers, lots of corporate structures, lots of buyouts. So it's important that we focus in on what makes something still your community place. With over 23 hospices in our area, you need to know that Hospice Savannah is your community hospice, the one that has been here for over 43 years. Why is a community-based hospice important? Because we don't have financial stakeholders. Our stakeholders are people like you, those who are vested in the needs of this community. When we needed end-of-life care back in the late 70s, Hospice Savannah stepped in. When we needed grief counseling for those who needed the mental health support, Hospice Savannah stepped in. When we needed a vaccination clinic going through a pandemic, Hospice Savannah stepped in. And when we need to learn how to re-engage and support our community in the most holistic ways, storytelling, reconnecting, Hospice Savannah is here. A number of services come through what we do for this community. We manage chronic and serious illness. We also help those through end of life into grief. We will be here for 40 plus more years, and you just need to know to ask for your community-based hospice, Hospice Savannah. Hello, my name is Kathleen Benton, and I am the President and CEO of Hospice Savannah. If I use the phrase pediatric hospice, it is not one that many like to say or discuss or even to acknowledge as something that really is needed, but it is. There are many children that have a less than hopeful prognosis, and Hospice Savannah is here to help. We are one of the only nation's hospices who take pediatric patients. And we are the only one in your community that has a butterfly pediatric program with our own specialized nurse, specialty pediatric physicians from Emory and from MCG who help support us. When a pediatric patient has a terminal diagnosis, the family might be seeking treatment outside the community, but want to be at home. They can continue this treatment, chemotherapy or other aggressive therapies, while hospice is in the home. That way, mom and dad and siblings have someone to rely on when they need psychosocial support, when they need resources like hospital beds or medication, or when they have urgent phone calls and don't want to go straight to the ED. A pediatric hospice program is a vital part of the community, and Hospice Savannah is humbled, privileged, and absolutely proud to be able to deliver that whenever it is needed in our community.